Hi, I'm Hector. I am a student nurse, and today I will be inserting a peripheral IV to my resident here. Before I go in, I'm going to verify orders. So I got that on my computer. I do have physician's orders to insert an IV into Mr. Brown's right forearm. I got my equipment ready, got the right room number, making sure it's Mr. Brown. So here I go. Hello, Mr. Brown. My name is Hector. I'll be your student nurse today. Today I will be inserting an IV into your forearm. Before I go any further, can I just have you verify your full name and date of birth?
Mr. Brown, XXXX.
Okay, thank you. Like I said, I will be inserting an IV, and that's mostly just to give you any fluids and push any medication if we need to. Do you have any questions?
No, I don't.
Okay. Are you allergic to anything, specifically chlorhexidine?
No, I don't have any allergies.
Okay. So I will be performing hand hygiene. Okay. Now the first thing I will be doing is applying a tourniquet. It is going to be a little tight, and you'll feel a pinch, but I will release it as soon as I can. I just want to palpate for a vein. Okay. Okay, this one looks good, so I'll just do it here. Release that. I will be using that again, so that's why I'll keep that there. Just hand hygiene. I got my equipment ready here. This is all unopened and clean. So I got my extension for my IV, a brand new thing of saline, which I will attach my syringe to my extension, making sure that my cap is loose. Okay, I'll keep it in that, keep it clean. I got my core prep. And today what I'll be using is a 22 gauge needle, which is appropriate for our procedure today. Okay, I'll be donning some gloves. Now I will be cleaning the site with the chloroprep. If Mr. Brown was allergic to chlorhexidine, I would have used alcohol prep pads. But since he's not, I got my brand new chloroprep here. I'll break it to release the fluid. Clean starting in the middle of my insertion site, and a circular motion going out for 30 seconds, and then I'll let it dry for another 30 seconds. Okay, I got my needle ready there. Okay, Mr. Brown, I'm going to be putting on the tourniquet again. Again, you'll feel a little pinch, but I'll make sure this is as quick as possible. Okay, I got my site prepared. I have my 22 gauge needle, which I will now open. I am inspecting for any flaws in the needle. I will make sure that my insertion is bubble up. Okay, I'll pull back the skin here, and I'll insert as close as I can, parallel to his forearm. Okay, I do see some flush, some red, so I will continue inserting. Okay, with one finger I'm holding the vein. The other two fingers I am stabilizing the hub. Before I release anything, I'm releasing my tourniquet. Taking out the needle now, making sure I'm not touching it. I will cap my needle and then put it in the sharps container. Okay, taking out the loose cap from my extension. All right. So I got that in. Before I do anything else, now that this is all clean, and sorry, before I inserted my needle, I would have a Chuck's pad under here. which I have a clean one right here. Okay, so this is all stabilized. I am inspecting for any swelling or redness. Mr. Brown, did you have any pain at all?
Nope.
Okay, good. So now that I got my extension put in, I will aspirate to see if I get a little bit of flush. With my extension, it was already primed with fluid. So I did get some flashback with the when I pulled back. So I'll hold this here, and now I am pushing in 3 milliliters of saline to flush, making sure I go slowly. So once that is put in, I'm still making sure that the site is still good and there's no swelling, redness. I could then cap my extension, take off the syringe. Okay, now I have my transparent dressing here. Making sure the area stays clean. Okay. On the other end of my extension cord, I will hold in place so it does not tug on the IV. I'll hold that with a piece of tape here. Okay, so I got my label here, which I will put on the needle gauge, which was a 22 gauge. Our date, which is October 28th. Our time, which is 12 o'clock. My initials. And I will put this right over the dressing. Okay. So now from here, I will document that the insertion only took me 1 attempt. I will ask Mr. Brown here if he had any further pain, and then I will assess the site, and which I will also document. So I will document the gauge, which was a 22 gauge, the patient's tolerance, and the insertion site, which again was his right forearm. I will clean up my area, and that completes my sketch.